and regional councils for international cooperation as part of an ongoing effort of sharing timely, interesting topics with our members and sector colleagues. Today's webinar was organized in collaboration with the Canadian Partnership for Women and Children's Health. And Katie Lloyd from CanWatch will just be saying a couple of opening remarks from CanWatch in just a moment or two. Our presenter today will be Tariq Banji, and the webinar will be providing very specific capacity building to members of the sector on writing health proposals for Global Affairs Canada in anticipation of a call for proposals this summer or fall. Tariq Banji has worked in international development and public health since 2000 in over 20 countries. Through a rights-based approach and by applying results-based management, Tariq has supported over 30 NGOs and secured over $150 million in funding from a range of donors, including Global Affairs Canada, the EU, USAID, CDC, and other multilateral agencies. So due to the quality and quantity of content that Tariq will be sharing, the presentation will last a full hour and a half. There will be no question and answer period, as was indicated in the various preparatory emails. However, Tariq has kindly agreed to respond to any questions relevant to the content of the webinar that are posted in the chat box by participants throughout the duration of the webinar. I will be collecting these questions, and the ones that are relevant to the webinar will be sent to the facilitator for his response. After the webinar, you will be asked to fill out a satisfaction survey. Only once you have completed the survey will you be getting an email back with the webinar recording, a PDF of the presentation, as well as the responses to your questions. You will be receiving these in 2 weeks' time. And now I'll just take a moment here to ask Katie Lloyd to just say a couple of words on behalf of CanWatch. And Katie, if you can just turn your microphone on if it's not on.
Great, thanks, Sarah. I think it's on now. So hi, everyone. My name is Katie Lloyd, and I'm the Senior Policy Advisor at the Canadian Partnership for Women and Children's Health. Thank you very much for joining us today, and as well for the Intercouncil Network for co-hosting this event with us. CanWatch has been partnering with provincial councils to host 5 workshops on health proposal writing for Global Affairs Canada across Canada. And due to the overwhelming responsive interest from members, we are also hosting this webinar to ensure that all who are interested in attending could access the information. The webinar is being recorded, and we will be posting it on our website after the fact for those who were not able to join later. And as well, CanWatch has many exciting projects and events on the go, so we encourage you to sign up for our newsletter and check out our website to find more, and I'll just be posting that in the chat box for your viewing. Thank you, and over to you, Sarah.
Well, thank you, Katie, and actually it's just directly over to Tariq. I will just type this and we'll go from here. Thanks, Tariq.
You're welcome. Thanks a lot, Sarah and Katie. Welcome, everyone. I hope I'll be able to walk you through this presentation in a reasonable amount of time. I'll try and get through it, and if there is time for questions, I will take some at the end. So we've done this workshop across the country in several cities, and this is the webinar version of it. Usually it's about a 4-hour workshop, and we're trying to condense it in an hour and a half. I'm just going to switch over to the slide mode, so just give me a second there. There we go. Okay. So the objectives of the workshop are to offer some practical tips on effective proposal writing, outline some of the key components for health proposals, and explain some of the terminology and components of an unsolicited proposal, specifically the template that's used by Global Affairs Canada, and provide a very, very brief results-based management overview. So this is the general agenda of the webinar today. We'll be looking at some of the eligibility criteria, looking at some of the priorities in health for Global Affairs Canada, some templates some tips on the template, as well as going through the different sections within the proposal template. I think many of you have a copy of the proposal guidelines that have been submitted to that are available on the Global Affairs Canada website, and that's kind of the template I'll be following throughout the presentation. I just want to make a quick disclaimer that anything that I am presenting in this workshop or in this webinar is actually not the perspective of Global Affairs Canada, nor of CanWatch or the ICN, and they're solely my perspectives based on my experience. And the objective is to provide you with some strategic guidance and some tips to think about when you're developing a proposal. If you do share these resources, just give credit to it. And again, it's not for commercial purposes, but you're welcome to distribute it if it's going to be used by people who are going to be writing proposals. So when we first look at the eligibility for a call, I would recommend that you actually go into the website shown, and there's a link provided there. When you look at that website, there's basically two options of submitting a proposal. One is through an official call, and there are a few calls that are open right now. For example, there's one in Guatemala. But so anytime the Global Affairs announces a call, it will be through this portal. The other option is to develop an unsolicited proposal, which we'll be talking about today. Regardless of the mechanism of application, the process is very similar in terms of an application form, and the components in the application form have been quite similar as well. So being familiar with the application form in the unsolicited proposal is quite useful. I would highly recommend that whoever does decide to proceed with an application form to look really closely at the eligibility criteria. If you are not eligible, then you should not apply, and I'm just going to quickly go over that in a second. So the big question is, should we bid or should you not bid? And the first question is looking at the eligibility criteria. If you don't meet any of the criteria, then it wouldn't make sense for you to bid because you would be disqualified right away. Again, is the intervention or the project you're proposing in a focus country or on the priority list by Global Affairs Canada? That there is a list right now of about 25 countries, and that might be modified very soon. You need to review the International Assistance Review of Government Priorities and to make sure there is a match. So as you heard yesterday, there was a foreign policy statement that was provided by the Government of Canada, and it is anticipated the International Assistance Review will be released on Friday this week, and that will actually clearly highlight some of the government priorities in terms of health as well as in development priorities. We don't really know whether there will be a change in the countries of focus, but that's something that you need to verify. And if there is a specific call, for example, the previous maternal child health call had an expanded list of priority countries. So as long as you're within the priority countries, then there is a match. The other thing to note is to make sure that you've clearly identified the need of the country and the beneficiaries. You have to make sure that you are being responsive. You don't just set up a program because you have an office in that country. That doesn't make sense. You have to respond to a specific need. It's useful to have some sort of presence in country to make sure that you can actually answer some questions, and also you have to make sure that you don't raise false expectations, because developing a proposal doesn't guarantee you're going to win the proposal. And when you do meet with counterparts in the country, you have to make sure that they're aware of the implications of your assessments or your meetings with them. Do you have an established office or partners on the ground? Again, it's very useful to have this. Even if you don't have an office on the ground, you might have to work with some partners, and therefore you need to plan for some Skype calls as well as ask some really specific questions around policies as well as content to develop the proposals. Again, the proposal development process has a lot of costs associated with it. I would say that it would take about a team, an entire 2 full-time weeks to actually put together a comprehensive proposal. And I also want to caution around infrastructure projects or creating things like, we call them white elephants. So building a school or building a hospital is not something that's encouraged because it needs to be sustainable. And a lot of funding that is around health programming is around more training, capacity building, maybe providing some sort of equipment and supplies, but not necessarily like constructing new health facilities. That might be an option, but it's not generally the option. So just something to be aware of, that if you want to, build a hospital or a school, there might be other more suitable donors that might meet your needs, or you might want to look at private foundations or individual donors as well. So once you have decided that you do meet the eligibility criteria and you want to go ahead and do an application form, I would recommend that you do look at the Funding Tools website. It provides you with a lot of links and resources that you could use for your proposal. You need to download the application package, and it's available in French and English. I would recommend that you download it early because some people have had issues downloading it. It only works in Internet Explorer, and when you fill out the form, it needs to be validated for you to enter it back into, or to submit it to Global Affairs Canada. So it has a counter on it that counts the page numbers, but it also has this thing that's a validation symbol on it that's validated. So it checks your application form, and if there's any issues with your application form, it will not accept it if it's not validated. And then every proposal needs to be submitted through a portal, and the portal is called, it's at Partners at International portal. And you need to register in advance, and all your documentation that's submitted to Global Affairs Canada is done through this portal. I recommend registering early. You don't have to do it like the day before your proposal is due. Do it like 2 months before, because you need some other documentation, like you need proof of registration, anti-corruption declaration, etc., etc. Many organizations, including the European Union as well as I think USAID, use similar portals to input information in. The portal is a good place because it'll store all your documents, and then when you're doing another submission, you can just attach the documents that you need, so you don't always have to put in your board documents or your registration form. It's just a repository that keeps all your documents. So you do need to keep the most current documents in there, but again, I recommend that you go in early and you get your password, and just make sure you set it up so that when you are ready to submit a proposal, you're not worried about these last-minute glitches at all. So let's start by looking at what are some of the priorities in health. So we've seen a very clear transition from maternal newborn child health to reproductive maternal newborn child adolescent health and nutrition. So this is the global movement in sort of the continuum of care around maternal newborn and child health. As you can probably look at some of the statements made by the minister, that the focus is actually moving towards sexual and reproductive health and rights, and on women's rights, and we'll find out this Friday where the policies are going to be in terms of health. But generally, what has come out that has been quite clear is that there needs to be some focus around comprehensive sexuality education, family planning, contraceptives, access to safe and legal abortion. So these are some elements that were not previously highlighted in health interventions, and these are areas that have been identified to have a lot of impact, and a lot of emphasis will be placed on these areas. There's also a significant focus on adolescent girls and women, and therefore your programming might need to gear towards these target groups. Gender inequality is absolutely essential, and it's looking at quite a broad perspective, looking at gender norms, social cultural practices, child early forced marriage, female genital cutting, mutilation, gender-based violence. Those are all factors that need to be considered. And looking at the structural barriers and systemic inequality, so access to information, social norms. Again, these are just my reading of what might be the priorities in health. It's a bit of a broader lens than just the classical clinical interventions. There's a lot of intersection between gender inequality and health, and it's definitely looking at it from a rights-based approach, from a feminist approach, and again, everything is going to be confirmed on Friday as well. So that's going to be something to look forward to, and this will hopefully will become quite clear through the international assistance review. So some tips on filling out the application template. So I would recommend that you prepare everything in Microsoft Word, and it's a maximum of 30 pages. there's a counter on the application template. It's quite generous. It's quite different from the previous counter, which was very difficult to use, and it counted characters, and you always ran out of space. But this one's a little bit more generous. I think it doesn't count your activities, or the way it counts is quite different. So don't be too concerned about your page limits, because it is quite a generous amount of information that you can put in there. The guidance in the template is really, really good. Please follow the questions in every section and make sure you answer them when you're actually responding to the template. When you're planning a project, for example, if you're planning a project now, so your start date, your anticipated start date for the project will usually be about 6 months to 1 year from your submission date. It takes about that long for a decision to be made and for the grant to be put into action. So when you're planning, just make sure you're planning ahead. So if you're going to start a project now, you probably should be planning for 2018. It's recommended that you do come up with an innovative title. There is a limit on characters for this, but that's the counter will not when you put it into the template, it'll stop you at certain characters. But it's not so bad. So make sure that you have a good title to represent your project. You need to list all your partners. So for example, if you don't have partners, if you are an organization that has an office in another country, that might be an option to put as a partner, but you might not. Hopefully, you do have partners, and so I think what Global Affairs is looking for is probably a range of partners, and partnership does show that you have a diversity of skill and capacity on the ground as well. At this point in time, in the application form, it's not asking for capacity; it's just asking for you to list the names of the partners. Again, I recommend you give yourself 2 days before submission and a good 8 hours to input it from the Word template into the PDF template. And I cannot stress this enough, you need to save as often as possible as well. So the first section is to start something called the DAC Coding, which is it's the Development Assistance Committee coding that's done by the OECD countries, and I think it's coding that Global Affairs Canada likes to see in terms of where your resources are being allocated towards. So for health program, there's these 3 general broader categories, and I've listed them there, that cover most of the components in a health project. There are other components. There is public engagement that can be covered under another code, and there's also maybe gender inequality that can be covered under another code. So just make sure that whatever you're doing in your program just makes sense, that it fits within the code. This exercise probably takes about an hour, and the guide is quite good, so just follow the instructions and you should be able to do it. Some people get quite carried away with this, but the general idea is to allocate what your approximate budget to each code. If you don't have to say 25.2%, you can just say 25%. So I usually just do an estimate of what I think my programming is in terms of the categories. A project can have, I think the form allows you to have up to 10 different codes, so you can break it down as detailed as you want. But if you go through each of these codes, it'll give you a sense of if you go through the document, it'll break it down like by health workers, by community awareness. There's different components in each of the categories. The coding is applicable for different sectors as well, so you would have to do it for education, for economic development, etc. So for any new global affairs funding done through proposal template, you will have to do this coding. Moving on to the executive summary, this is probably the most important part of your proposal, because you're trying to tell the story of your project in one page. It's your sales pitch, and it has to be solid, it has to be clear, it has to be objective, it has to be succinct, and cover almost all the elements in your proposal. I recommend you write this at the end of your once you've developed your proposal, and it should cover the things in the guidance notes. They usually say that they want 1 paragraph. I usually write a very big paragraph, which ends up being about a page. You talk a little bit about your overall goal and objectives. You can talk a little bit about where the project is going to be implemented in terms of geography, and I'll talk about that in 1 second. Your partners, who your partners will be, what are some of the results, what are some of the beneficiaries, and again, don't exceed 1 page. Try and keep it within the page at least. So moving on to the next slide, looking at the beneficiary numbers. Generally, I like to categorize beneficiaries in 2 categories. The first is direct, which is usually by age and sex, and it needs to include all the intermediaries or people like health workers, community resource persons, and leaders. And then there's the indirect population, which is basically the population of districts and the communities you are working in. Make sure you do not double count, and make sure if you don't really know, make an estimate. But it's really important to be able to calculate how the beneficiaries of your program. Usually, the direct beneficiaries are basically anybody that you touch, whether it might be through a social media campaign or you're providing awareness or information to them. So your numbers are generally quite high depending on your program, but they'll be variable depending on the types of interventions that you do. So this needs to be included in your executive summary. Previously, they had a beneficiary section, and now they don't have that. So I usually put this in my executive summary. The next section is around rationale, and again, another very important section. And how I like to write this is I start talking a little bit about what's happening in the country, and then I move to the specific geography within which my project is being implemented. But some of the things that need to be talked about are, first of all, the development, the needs and the challenges. So you need to provide this with statistics. So if you're talking about a program in health, you might need to talk about the maternal mortality ratio or the adolescent birth rate. And it's sometimes useful to contrast maybe national versus the region or district you're working in. For example, if you're working in an area in Burkina Faso where the national rate is 500 adolescent birth rates, that might be a bit too high, but in your district it's half or double that, then you can show the contrast. Again, you also need to show the alignment with Global Affairs Canada's policies. So there was a Children and Future policy which still exists, which will be in place until the next policy comes out, and there were some maternal newborn childhood priorities. And then there was an announcement made by the minister, an initiative called Her Voice, Her Choice. So there are some priorities in there as well. But I think the priorities will be clearly outlined once the International Assistance Review comes out. So I would make sure that you're in alignment with that. Your program also needs to be aligned with the national policies. So you need to look at how the health policy, the reproductive health strategy, or any policies that have been in that country you're implementing, and how your project aligns with that. The rationale is a section where you also talk about if you've had any consultations with beneficiaries. It's encouraged that when you design your proposals to have meetings with government, partners, and beneficiaries. And therefore, if you have presence on the ground, that's really, really useful. If you don't have presence on the ground, you'll have to probably ask some help from some of your partners on the ground to have these meetings for you. Global Affairs Canada also wants to know that you're complementing some of their efforts as well as that of other donors. So, but you're not supposed to duplicate anything. So, if you have an opportunity, you can meet with the desk officer in the country you're going to be executing, and they will generally tell you where their funding is going. But also, you should coordinate with the Ministry of Health and find out if there are other players in the same district. So, if you want to do a nutrition intervention in a district in Malawi, and there's somebody else already doing that, it wouldn't make any sense for you to do it there. So that's something that you need to have a conversation about. And when you do submit a proposal and you haven't verified this, you probably will get called on it, because the proposal is verified by somebody in the country who does know who's working where. So it's important to do that mapping exercise to get a sense of who's doing what where, and you're adding value as opposed to duplicating. And then if you have some key lessons learned and best practices, just discuss this and how you would integrate this within your proposal. You can use other people's work. You can use your work. It's just trying to demonstrate that you're using some innovation. And I think there's some guidance around this question as well. So I talked a little bit about defining geography. It's really critical to decide where you're going to implement your program and why. We tend to work in doing interventions, but we already come up with an idea, but we don't really necessarily know it's actually responding to a need. So it's important to validate that and make sure you're actually reaching the most vulnerable population. Again, the area that you've selected to work in, is it actually an area that's a priority in the government? Is it an area that has a lot of high needs? Have you had an experience in this area? Do you have infrastructure to support your work in this area? Do you know the total population of this area? Sometimes people are, pick a geography before they actually do an analysis, or they might pick an example is, when I start a program, people are like, we want to work in 20 districts. And I'm like, that's great. And then when they do the budget, it comes down to 2 districts. You have to look at the scale, whether it's rural or urban. If it's urban, it might be cheaper to do things because everybody's closer. If it's rural, it might be expensive because everything's far away. Is it spread out? Is there roads that go there? Is it affected by floods? I've had projects where we couldn't reach beneficiaries. We had to use a boat because they were on remote islands in a lake. So there's a variability in the types of geography, and that influences how you design your project as well. But it's important to define your geography because that will help you with your budgeting, as well as to make sure that it is a priority area and the needs of a specific population are met. So I can probably take one question on the previous section if anybody has a really quick burning question on the last section before I go into results-based management. I can see, I think Clark is typing something really quickly. Okay. Let's see. So Clark is asking whether there's alignment with DAC priorities. What is my sense to align with more than one focus area? And is it necessary? So in the call for proposal, it'll be specific on where there is alignment and if it's necessary. I think the way the priorities are written, they might be quite broad. For example, the previous priority was children and youth, and it was quite a broad area. So it might have subcategories. You just have to be clear when which priority you're addressing and why, and you have to look at the call. So if it's strategic also, I don't know if I can provide clarity on that in terms of if it's better to align with one or not. But what you need to look at is the broader policy, and then what are the subcategories, and if you can address the need, then specifically, then great. If and if you can do more than one, that would even be more value. But it's also very, very specific, and I think maybe that might be more relevant to your organization because you're dealing with just eyesight, and that might be a very specific issue. So you have to see how it fits within the broader package of the policy. What I would recommend is that you would probably speak to somebody at a desk that the country you want to execute in, and get some clearance, or have a discussion on whether the program can be focused. Usually the calls tend to be more of a broader range, and they want to cover a broader range of interventions. If you do have a specific intervention, like I know there has been funding for things like economic empowerment, gender-based violence, there are very specific initiatives, and there might be a specific call, or you can do a specific unsolicited proposal, but then there's no guarantee that there would be funding. So I think it's a decision that Global Affairs makes. I don't know how they make that decision, but I would encourage you to have a conversation with them before you start writing your whole proposal based on a specific single-focused issue, if that's how I understand your question. So hopefully I've answered that question. I'm going to move on with the presentation. So looking at results-based management, again, there is an excellent resource that's provided on the Funding Tools website, and it was recently updated last year, and I would highly recommend that if anybody's doing any sort of writing for Global Affairs Canada, or for any other donor, in fact, is to look at that document, because it provides you with really good examples as well as structuring how you would write your result statements. But what I would like to just quickly go over are just some things in a results chain. So if we look at a logic model, we have different results, and we go from inputs, activities, outputs, outcomes, and the outcomes are divided into immediate, intermediate, and ultimate. So the ultimate used to be called goal, and these used to be called objectives, and the names keep changing. But once you get the idea of how it all works and how it's all linked, it doesn't matter what they're going to call this, as long as you understand the relationship between them. What I would like to emphasize is probably this slide, and this slide, if you are to take anything away from this presentation, it would be this slide. And what we look at is the results that go across a project. Usually the ultimate outcome, it's the long-term result, sustainable change. And it could be like mortality rate, birth rates, etc. So these are usually beyond the life of the project. While these are included in an unsolicited proposal, or they might be included in a call, they're not something that your program would focus on as sort of programmatically. They would achieve, so we would contribute towards maternal mortality rate, but we won't necessarily be specifically focusing on that issue. So they're a little bit larger and beyond the scope of your project. So I wouldn't be too concerned about the ultimate outcome. These are also usually aligned with the SDGs, and we'll talk a little bit about that when we talk a little bit about the other sections. But what we look at, what we focus most of our programs are on these two areas. So the intermediate outcome, which looks at medium term. Again, I'm going to emphasize change in behavior or practice or health among beneficiaries by the end of the project. Again, the focus is around utilization, behavior, and practice. Usually it takes 3 to 5 years to achieve this. So this is something that you would achieve within a 3 to 5 year project. So that's an area that you need to focus on, and it's an important area. The immediate outcome is basically something that you see between 1 to 2 years, and it's basically change in knowledge, skills, and capacity, and availability. And these are short-term change that's attributable to several outputs. Now, what they've done in the recent RBM or the format of the proposal is they want us to do outputs, and the next slide will highlight the way it's broken down. But outputs are basically completed activities, and they're usually things that are almost immediate. In terms of if you train somebody, you have trained health workers. It doesn't necessarily mean that the health workers will use those skills yet. It's just a completion of an activity. So there's a big difference between an output and an outcome, in that the outcome actually takes whatever is done in the output a step further. So there's increase in skills, increase in knowledge, and an increase in capacity. And again, the guide is really, really good at explaining this. So I would encourage you to look at that guide. When you do a result statement, these are some tips that you need to think about, and one is to make sure that it's simply worded and it contains one idea and it's specific. Can the results be measured? Is it achievable? Is it relevant? Is it timely? So for an ultimate outcome, again, it's very high level. You contribute, and in some examples, it contributes to reduction in maternal mortality, improvement in health and well-being of a community, improved sexual reproductive health and rights. So these are some examples of some ultimate outcomes. So if there is a specific call, Global Affairs Canada might already give you these outcomes. If there isn't a call, you can formulate an ultimate outcome. Again, it's looking at the broader picture. When you design a health project, this is generally what a logic model for a health project would look like. So the order of the outcomes, the order of like outcome 1, outcome 2, outcome 3 can vary. It doesn't have to be outcome 1, outcome 2, outcome 3. The order can vary, but the components are generally quite similar. So one component focuses around the health system side, And that looks at sort of strengthening the delivery of services. So that's within a health facility. So it's looking at training of health workers, some rehabilitation, you strengthen the management. And ultimately, you're trying to improve the quality and delivery of reproductive or sexual reproductive health rights services. The second component is focusing on the demand side. So it's around the community component. And this is looking at increasing the utilization of services. So some generic activities are things around information, raising awareness, having social norm change, working with leaders and community structures, community mobilization, etc. And then I like to call this other category, and you don't have to have a third category. You can just have 1 and 2, and you don't have to have 3. The most you can have is 3, but this is just another broader category. And I see many organizations and many people either tackle things around knowledge management, around policy and advocacy, public engagement, work around rights, work around organizational development. And these are like, some of the activities are like strengthening the health management information system, working with policymakers, advocacy, and engaging Canadians as well. So that's generally what a logic model for a health program would look like. Again, there's a lot of variability in it, but these are some of the essential components, and this is how I would structure a logic model at the intermediate level. So the key points to remember about the logic model are the ultimate and immediate outcomes may be provided in a call. So in the previous maternal child health call, they were provided. The currently maximum amount of results you can have is three intermediate, 3 immediate, and 4 outputs. So that's quite a lot of information. But I recommend that less is better. So I recommend maybe 2 by 3 by 2, or 2 by 3 by 4, or 3 by 2 by 4, but you don't have to do the maximum, but that's how much you can. And then, make sure you include all the critical components. Again, just to re-emphasize, like the previous chart I showed you, 3 to 5 years for intermediate achievements at the end of the program, and then you look at change in behavior and practice. With immediate, you're looking at shorter term, 1 to 2 years, again, increase in awareness and skills and increase in access. For outputs, you're looking immediately after the activity, it's within 6 months, and examples are training. So previously, you had to, an output was a completed activity, but now these are not in the logic model anymore. But you're allowed up to 10 outputs per output, 10 activities per output. So in the proposal template form, you can have up to 360 activities. That's a lot of activities. I wouldn't recommend going to that extreme, but in case you need it, there's a space for it. So basically, the template will allow you to do 3 intermediate outcomes, 3 immediate outcomes per intermediate outcome. So it's 3 by 3, which is 9. And then 4 outputs per intermediate outcome. 9 times 4 is 36. And then you would have up to 10 activities. So 36 times 10 is 360. So that's a lot. So usually for many programs, I recommend doing maybe 1 or 2 intermediate outcomes, maybe 2 to 3 immediate outcomes, and then maybe 2 to 4 activities per immediate outputs per immediate outcome. So there's a lot of information to take in there, and I'm just wondering, maybe I'll pause quickly for a really quick question if there is a question. Nope? Okay. I think it might be... oh, okay, we see somebody typing there. There's somebody from the... somebody's typing. Okay, I'm just going to proceed, and maybe I'll leave some room for questions in the end. So, looking at the theory of change, so this has replaced what used to be called a description of the logic model. And in this section, we talk a little bit about the assumptions made. You explain your strategy here, and basically you say how you designed your project in terms of how did you come up with your logic model, and you describe the relationship between different levels of your logic model. So what I like to do here is I like to talk a little bit about some of the underpinning theories and some of the best practices that you use in developing your program. And in health, we usually use some of the evidence-based practices, and there's things like the 3 delays, which is delay in accessing services, delay in reaching facilities, delay in making a decision to receive healthcare. And then there's a continuum of care, which has been a global best practice. And some of these resources are actually at the bottom of your slide deck, or they will be provided to you, so you don't have to write these down. And but there's a lot of resources out there that do provide you with this critical information. You can also integrate some innovative research, so you can try and do some operational research within your programs, and you can try and build it into the design. However, I just want to caution that these programs are not specifically for research; they're for implementation. And there are other avenues that explore research, like grants from IDRC or grant challenges that look specifically at research. But what a program like this allows you to do is that there might be some innovations that you want to integrate within your programs, and that's what you can do at this stage. I see the comment from Sarah regarding questions. Yeah, so if you do have a question and you type it in, I might be able to answer it when I take a break. So sustainability of resources is the next section, where we look at what's going to make this program sustainable. And there's about 6 categories there that you should probably talk a little bit about. So the first thing's around capacity building and training of health workers. So if you do that, you're actually building sustainability within the program. Have you engaged the community in your design? And if you have, then you'll be enhancing the local systems, and therefore it is sustainable. Are you coordinating with government counterparts or other players on the ground, and how are you harmonizing so that everybody provides the essential services that are needed? Is there integration within the national district health budgets? You need to link with the Ministry of Health, and maybe your project can be scaled up. So that's what I would like to say about sustainability. I'm going to go back to a really quick question that was posed around proof of concept. I think the proof of concept is a little bit different from theory of change, because theory of change is actually saying that this is what we're proposing as our assumptions. A proof of concept is more like it might be a concept node, and maybe according to how you understand it, it might be the same as theory of change. Because if you Google theory of change, you'll get thousands of ways of writing a theory of change and a definition of it. So I wouldn't say that it's necessarily a proof of concept, but it is validating how you came up with your strategy. And I think you need to provide some documentation and information on how you would actually be able to justify why you chose the approaches you chose. But remember that what Global Affairs is looking for some of that justification, but it's also looking for how the different levels in your logic model are connected. So you need to explain in narrative form how your output is related to your outcome, and if we provide information on safe abortion, for instance, will uptake of services improve, or will we have less complications? That's just an example. Or if you provide information on, let's say, early pregnancies or preventing pregnancies, early pregnancies, then maybe at the facility level you'll see less people are presenting themselves with complications. So I think that might be something to look at. So I'm just going to proceed, and I'll go back to your questions later. But looking at your activities and your outputs, again, are they in line with some of the best practices? So I said, look at the links of the practices. And some of the examples of outputs are, again, health workers trained, communities mobilized, awareness raised, campaigns organized. And then each output can be broken down into 10 sub-activities or activities. Again, the guidance notes, the guidance document of results-based management will really help you design your logic model. What I'm providing is some sort of tips in terms of trying to make it more health-focused, but I would recommend looking at that and following that guide as much as possible. So moving on to the next session is around preliminary performance measurement. So when you're designing a proposal, global affairs only requires a partial performance measurement framework, and that's looking at the indicators, the baseline data targets at the intermediate and output level. What I recommend people do is you try and use global indicators. So there's the Sustainable Development Goal indicators under Goal 3, and then some of the indicators under Goal 5, which are under gender equality, and they prescribe some of the indicators. Also, WHO has some indicators. If there's a call, they might prescribe some indicators. So previously in the last call, there was 18 indicators, and you had to pick, I think, 4 of these 18 indicators. So if there will be a future call, there's most likely going to be some indicators. Also look at what is being done at the national level. There's usually a health management information system and a district health information system that have some really good indicators. So if you can actually use the same indicators, it would actually be really, really useful. I also wanted to refer you to this link called the Radar Project. It's a project that's funded by Global Affairs Canada with Johns Hopkins and CanWatch. And they have quite a few resources in terms of some of the best practices and research around collecting health information and metrics. So I'd encourage you to look at this. Also, just a plug for CanWatch, there's going to be quite a bit more information around data collection and metrics. So I would just keep abreast on the website and speak to maybe Katie or other people at CanWatch if you need some help with this area as well. When we look at indicators, they should be direct. They should directly measure the results. And I really have to stress that you should only collect information and gather information on things that you really need. And again, you can only measure what you can gather information on and report. If you cannot collect data on it, you cannot measure it. Also, there's a tendency that we'd like to collect a lot of information and we don't use it. And I think it's from a resource perspective, it's wasting your time as well as your beneficiaries' time. So be very specific, be very practical about how you collect indicators. To actually collect indicators, to actually collect information and to monitor and evaluate, you actually have to implement the program for at least a year to 2 years to actually see results. So just make sure that, yes, spend some time on M&E, but make sure it's balanced. And when you do come up with your indicators, make sure they're practical and are they clear? Are they comparable to national data? And make sure it's disaggregated by sex. So you make sure that you collect information on boys and girls, men and women. Again, there's quite a bit of guidance in the RBM handbook, so I would recommend you look at that as well. So maybe I'll just take a moment now to just answer any questions on results-based management specifically, or the sections we just talked about. Is there anything specific that anybody wants to raise at this point in time?
This is Sarah. There were just 3 questions that were posed in the last little while. One specific to RBM. So Julie's was specific to RBM details country by country. But there are 3 questions right there. Let's see which one you can answer now and which later.
Yeah, I'm trying to scroll up the screen. I can only see the last question from Fatima. Within the concept of data management, what gets measured gets counted. What benefits would be benefit with randomization being a concept of inclusion? That's a pretty complicated question. I don't know if I can be able to answer that. I think it's getting very specific into how you design your indicators and how you would measure things. I don't think I'll be able to answer that one as part of this webinar. What I would recommend is I would just look at more specific resources in the RBM guide to look at that in terms of the measurement and coming up with your indicators. But my advice is keep it as simple as possible and make sure you align with national and global indicators as much as possible. I'm trying to scroll up on the questions. Let me see if I can actually get to the next question.
I'm happy to read that, actually.
So there's
a question from Grace, and the question is, how would you differentiate duplicated efforts versus harmonization with existing systems? And a second question from Julie.
Sure.
Do you have recommendations for presenting multi-country proposals? Is it better to present content or RBM details country by country or thematically? So those are the two questions.
So they're really two really good questions. So the first one around duplication of efforts versus harmonization within existing systems. I think it's a little bit of both. If you are going to design a health program within a specific district, I'm hoping you would speak to the district medical officer or the relevant health authorities to make sure that they will tell you and they know what's going on, in terms of the programming. So you're not doing something that's already being done. In terms of harmonizing with the existing system, so for example, if they're collecting a specific data, then you should collect it the same way they're collecting it. So you're harmonizing within the existing system. So duplicated efforts means not doing the same thing that another organization is doing, and harmonizing is kind of working in sync with whatever's going on the ground. So if there is, for example, a training manual on basic emergency obstetric neonatal care, there's no need to create a new manual. Just use the same manual. You can harmonize in terms of using whatever is already available. So hopefully that answers your question. To ask around multi-country proposals, so they're a little bit complex because in an unsolicited proposal, you're using the same template to put in all this information. I think your indicators need to be harmonized for a multi-country proposal. Where they would be different would probably be at the output level, but again, as much harmony as possible is important. What I've done with multi-country proposals is I would provide a very comprehensive RBM, so my logic model is quite comprehensive, but I wouldn't be doing all outputs in all countries. So some countries won't do some outputs, and I think that's the way I would distinguish them. But the higher level results at the immediate and intermediate level are all still need to be harmonized. Otherwise, it would be separate programs, and it wouldn't be one program. So that's how I would approach it. So I'm going to proceed with moving forward because we still have quite a bit of content, and then I'll try and take questions at the end as well. In terms of the initiative management plan, so this is basically a story on how your organization is going to execute the entire program. And one of the things that they are looking for, which isn't mentioned in this slide and I forgot to put it in, is around performance measurement and how you're going to collect information. So I think writing a small paragraph on talking a little bit about, how are you going to collect your data? Are you going to do an end line and a baseline or a midterm evaluation? There is a question in the guidance notes that actually asks you to focus on that, so I would recommend that. But the other sections in the initiative management plan are pretty straightforward. They talk a little bit about human resource staffing. They talk a little bit about, so here you talk a little bit about your personnel in country and within the organization, who you're going to hire, and then you're going to talk a little bit about some of the roles and responsibilities of your partners as well as project stakeholders. Is there going to be a management structure? Are you going to talk a little bit about the financial system? Do you have an accounting software? Do you have an audit that takes place? What are some of the policies that your organization has in place for safety, security, gender, HR, etc.? And then a little bit around how you're going to manage sort of the day-to-day operations of the project. So basically, if you are going to receive money to do something, you basically have to say how you're going to manage that in terms of the operations and finances for executing the program, and a little bit around the monitoring and evaluation. So that's sort of the initiative management plan that Global Affairs is expecting you to write about. When we talk a little bit about the risks, so part of the application process is putting together a risk register, and again, this has evolved quite a bit. Previously, you had to rate your risks, and now you don't. All you have to do is state the potential risk, where it affects the logic model the most. So you would outline just by number, whether it's 1120 or 1200 or the entire logic model or the entire program, and then you would provide some way of mitigating the risk. So these are some common examples of some risks that I've seen throughout some of my work. So you have risks around political or social strife, elections. You have risk around natural disasters, earthquakes and floods. You have risks around human resources, because usually there's staff shortages and motivation. Risks around whether the government will support a specific program or they might change their perspective on things. Around community support and motivation of volunteers. So there's quite a range of different risks, and it's very specific to every program, but they expect you to do sort of a little bit of a risk analysis. So if you're going to be working, for example, in an area that's got a lot of conflict, or or frequented by a lot of like floods, for example, Bangladesh, or a famine possibly, or drought, then you need to incorporate this into your programming and how it would affect your programming, and you need to talk a little bit about it. The next area is environmental sustainability. So I'm moving into the cross-cutting themes, and we're almost probably about halfway, more than probably 2/3 of the way. Maybe if there's one question I can answer around the previous sections, I could probably take that. I'm trying to look at the question board there, and okay, there isn't new questions, so I will just continue, and we'll save time for questions at the end. In terms of environmental sustainability, again, there is some guidance on doing an environmental impact assessment, and there's a screening tool that has exclusion and inclusion criteria, and then your proposal needs to work according to this. So what I recommend mostly for health programs is, if you are going to do a health program, unless you have a lot of experience in infrastructure or are a specific organization that works in water and sanitation, I wouldn't do a lot of infrastructure and construction, because it requires quite a complicated process, and if you're not familiar with that, it's quite difficult to do. What are the important things that you might want to consider are things around medical waste, so looking at incinerators and placenta pits. Those are quite important for health facilities. Looking at some sort of rehabilitation of health facilities. So in some cases, bringing water to a health facility or building a toilet might be necessary, but you have to make sure it doesn't trigger an environmental impact assessment. And then looking at things around water and sanitation. What I recommend for most people to do is to look at the screening tool and see whether exclusion or inclusion criteria is, and minimize things that actually would trigger an environmental impact assessment. Things like maternity waiting homes or resident buildings for staff in rural remote communities are things that would trigger an environmental impact assessment, so I would be very careful how I would respond to those. Another really good way to deal with this is, if you want to do some construction and you don't have the experience, partner with an organization who does. They'll be able to fill out all the forms and do the right processes that are required for an EIA. So I'm not saying do not do infrastructure in terms of some necessary things, but if you do, just be strategic about how you do it and follow the processes that go with that. The next very important area is is talking a little bit about gender equality in health. So again, gender equality refers to the same opportunities for groups of women and men to access and benefit from health services. Women and men have equal conditions to realize their full rights and potential to be healthy, contribute to health development, and benefit from the results. So same chance, equal under the law. So when we look at why do we focus on gender equality? Because we want to close the gender gaps. We want to address the unique needs of different groups, including men and women, boys and girls. We want to transform the gender relations, so social norm change, transformative change. And we have to make sure we do no harm. So under the Global Affairs Canada policy, there's three statements that focus on decision-making, rights, and access and control over resources. Any program must address one or more of these, and you have to clearly discuss how you're addressing one or more of these. I'm going to talk about that in 1 second here. So when you're writing your gender section, what I recommend is to start off by discussing some things like what are the issues on the ground in terms of some of the statistics. Is there issues around, early marriage, who makes the decisions, etc. So give a little bit of context, and then you need to talk a little bit about the national policies that are in those countries. You need to talk about these 3 objectives and how your program is actually going to meet these objectives. If you can do an analysis before, it's great, but most people can't because they are costly. It is a requirement that you should do a gender analysis once you receive the contract or the award. So I would recommend that you budget for it, but you still do need to do some sort of analysis to be able to write up some of the key gender issues that are important within the program. Also, Global Affairs Canada is very concerned about gender, and it's a big priority. So make sure that when you are doing your logic model, that your language within there is quite is gender sensitive and does maybe have even 1 or 2 gender equality results within your logic model. And I think there is some guidance notes around that in the RBM manual as well. So I would highly recommend you look at that and definitely review your logic model to make sure that it does have some gender components in it throughout the entire program. Looking at governance, so governance here is looking at the capacity of the existing of your project within an existing system and how your project is going to work in terms of link with the existing governance structure. It's not about how you will govern an organization or talking about government or talking about politics in a country. It's about how your project fits within the governing structure. And it's important to discuss this a little bit. So for health, the most relevant would be talking a little bit about, village health committees, community health management committees, how they interact, how messages are related, what is the structure of local government in terms of delivering health services, and how your program fits within this. So there is some good questions along the guidance in the guidance notes as well. So I would recommend you follow this. Human rights is another important element that's discussed, and under health, the most important is the right to health, which is basically timely, acceptable, affordable, and appropriate quality of health. So these are issues that you need to address. Again, really good points into the guidance notes that you need to follow. This will vary by projects. So some projects might have other rights that you might need to talk about. A lot of people talk about, the CDAO and the Cairo and different principles that come into play that you might want to bring in. For example, more recently, the indigenous rights are important in some countries and in some contexts. So you can bring those into play as well at this component as well. So this is probably a part where a lot of people have questions on finance and budgets. So the new template has a budget by 2 kinds of budgets. So one is summary by eligible costs and summary budget. So the previous budgets used to be on activities and by outputs, and now it's changed quite a bit. So this budget is quite complicated to work with. So for example, if you had 360 activities, you would have to break down each activity into these eligible costs to get your summary budget. So it's a lot of work. And you have to understand some of the cost categories. So what I'm just going to provide is some tips on budgeting. And basically, you need to do an activity budget by cost category, and then you roll it up. So you would you need to come up with all your activities or your sub activities, and then for each activity you break it down by the different cost categories. So if you have a very complex program, you could have up to 3,600 budget lines. Just saying that. So just to be aware how you design your project is really, really important. I would recommend, again, using Excel. That way, if you decide to change a geography or change a number or a cost, it's easy to just change all the formulas as opposed to trying to rebuild your budget again. And again, like I said, your activity needs to be broken down by sub-activities and costs. You need to budget on an annual basis. So if you have a 3-year program, break it down by year. Budget in local currency and in Canadian dollars. So if the currency of that country is not stable, for example, Zimbabwe, then use US dollars and then use Canadian, but do it in both. Make sure you do your inflation rate on an annual basis. There's some eligibility criteria for contractors. So you would have, I think, a maximum limit of 20%. So make sure you read some of the financial notes that goes in within the template that explains some of the eligibility criteria. You need to account for all your direct costs. So the programming at DAC is quite generous in terms of covering the costs of the entire program. So make sure you account for all the costs, and make sure you account for all the eligible costs, as opposed to some of the costs may not be eligible. So just check the lists of eligibility within the finance section. Again, maximum allowance for overhead is 12%. So just be aware of that. I recommend that you need at least 5 days once you figured out all the details of your activity. So for example, if you decide to do a training workshop in safe abortion care, so you need to know who your trainer is, how many people are going to attend, how many times you're going to do the workshop, where you're going to do the workshop, how much it costs for the food, for the transportation, for the accommodation. That's the information you're going to need before you do your budget. So the level of detail you need is quite significant. And then in some cases, you need to provide a match, and the match is variable between 5 and 25%, and there's different ways that people do this. So those are some tips on budgeting. I don't necessarily do when I work with programs, I mostly develop a budget based on the activities, and then the finance staff develop the full budget. But it's important to be aware of some of the things to think about, and it's important to work with the different budgets. And we're almost done, and then I'll answer as many questions as I can. So the last section is around relevant experience. So they want to know the profile of your organization. So you provide your mission, your mission, your vision, some information on what kind of things you've been doing, how long you've been around, and they need to know a little bit about local capacity. So you provide information on your partners or whatever experience you have on the ground. And then the last section is around 2 project summaries. So the summaries, what I typically advise people to do is to provide an example of a summary that's either in the same country or in the same thematic area. And then also your summary should demonstrate that you're able to manage at least half or more of the budget you're asking for. So if you're asking for $2 million and you put an example of $20,000, I don't think that demonstrates your ability. You might want to put something that's maybe 1 million or 2 million or the same amount or more to show that you're able to actually manage and have the capacity to manage those funds. Sometimes if you don't have the expertise in a specific area, you can always provide one summary sheet for yourself and one for your partner. There isn't any specific rules around that, so I would recommend partnering can be beneficial. And that's basically the really quick version of the full webinar. So I'm going to spend some time answering some questions. So I'm going to scroll up a little bit and see where the last question. So the last question I answered was around multi-country proposals. So I'm going to go to the next question there.
The next question is actually by Kevin Tarek, and it's and I'm happy to read them out to you. Okay. It's is budget on fiscal year, project year, or calendar year?
So how I recommend to do it is you would when you're designing your program, you should just do it by year, and then it usually has to align with the Global Affairs Canada fiscal year, but you don't know when you're going to receive your funding. So if you're designing a program, let's say for 2018, yeah, your start date 2018, but I would say my year 1 is basically the year that I actually get I would just do it by, like, if it's a 3-year program, I would do year 1, year 2, year 3, and then when you actually get the funding, you would adjust your timeline based on your years. It's very hard to kind of align the timelines because you don't know when you're going to get funded. So I would basically plan around a year, but then you would adjust the timing of your years based on when things start. But generally, the reporting years would be in alignment with Global Affairs Canada. So basically, the fiscal year is basically, I guess, April to March.
Wonderful. The next question.
So hopefully.
Sorry, am I okay to go ahead, Tarek?
Yeah, go ahead.
The next question is: are local partners, example CBOs, defined as contractors?
So you would have to ask Global Affairs for that one. I don't want to give you a response that I might not be able to confirm. Local partners are, it depends whether the partner is registered and they're not consultants. It's a little bit different. I think if you do put them in as a partner, then they're not considered a contractor. But again, I think that's something you have to clarify with Global Affairs, so I can't clarify that for you.
And the last question on the screen is there any project funding for capacity building?
I think it depends on how you design your program. Remember, absolutely, I think training of health workers is capacity building, so that would be actually something that's very valid, that many people put in programs. But remember, I talked a little bit about the third outcome, and you can actually use that to build capacity. Again, how you present it and how you make the case is it's tricky, but you definitely can, because the idea of most programming is to build capacity and so that it's sustainable. So definitely, it would definitely include capacity building. But again, it has to link to the objectives and the results as well. So it might be more specific capacity building. But I have seen capacity building that does organizational development and building governance structures and helping smaller organizations as well. So there's a range of capacity building opportunities.
Wonderful. And the next question is from Grace. You stated that the budget should adjust the timing of the year based on when things start or when you get the funding. And the question, does it make the organization look bad or less eligible if they're applying for funding for an ongoing or already started project?
Well, I don't know about eligibility, but if you're already getting money to do a project, then you wouldn't be applying for funding for it. It would sort of be you're already getting money for a project. So I think the way you frame it, maybe if you say we're working on phase 1 and we want funding for phase 2, then maybe that's feasible. But if you're already getting money and you then they'll be like, it's already being funded, why should we fund it? That's how I would look at it. So I think it depends on how you frame your project. Many organizations do design proposals, and then they do provide it to different donors, and then whichever donor funds it first, they will go with that donor. That's an approach organizations use, but I can't specifically tell you not to apply for it. But I'm just saying that if they already know that you're getting funding for it, it'll make it more difficult for them to fund because you're already being resourced.
Are there any other questions that participants might have at this moment? We have about 10 more minutes, and then I'd like to do some closing remarks.
I should have mentioned something that regardless of what mechanism of funding that you're applying for, the template's going to be similar. And we know that there's two things that are happening right now. One was there was $100 million that was announced about a couple of weeks ago. That's going to be for small and medium organizations in different areas of development, which haven't been clearly defined. And then there's potentially going to be money for health, which was announced also by the minister. So one might be a call, one might be a different process. But regardless of whatever the mechanism, some of the steps within this webinar and some of the tools are very similar. So you still need to think about the rationale, the logic model, some of the thought processes. So just in terms of a useful tool, just look at this as, regardless of what mechanism you go for, this is some of the things you need to consider, and it needs to be contextualized depending on the call or what is required. So it will change for every call, and just be aware of that. But generally, the thought process and the steps are very similar. So this is something for you to be aware of. I see a couple of questions.
Sure, and I'll start from the top here. So first, there's a question about, is there any discussion of reverse innovation or addressing Canada's development needs in parallel?
It depends on how you frame your project. I've seen projects that have some focus in Canada. For example, you could work on Indigenous health here and have a parallel program. It depends on how you design it and how you pitch it. I don't know. I would be able to answer that on behalf of DAC because I don't know how their funding is allocated.
And wonderful. The next question is from Carmen. Why does the budget need to be broken down by activity? I don't see that in the application form.
So it's not required by activity, but how are you going to come up with the cost categories if you don't do it by activity? What my experience has been that you could submit a budget, and then once you get approved, you have to do another detailed budget. So when you plan, for you to plan and manage a project, you kind of need it by activity. But if you feel that you don't need to do it by activity for the proposal stage, then by all means you don't have to. It's just something that I do as a practice. But again, people have different ways of working with budgets. I just find it's really hard to figure out the actual cost of what a program might be if you don't do it by activity. So that's the approach I use, but it doesn't have to be that way. Previously, it used to be that way, and usually Global Affairs has asked for clarifications on detailed budgets once you get approval. So there's just something to be aware of.
And the next question from Brett, do you have any advice in terms of percentage allocation for staffing in health programming?
No, nothing specific. I mean, you could have an entire project that just focuses on that, right? So it really depends on it. There's no right or wrong as long as your justification, your rationale makes sense. I think you just have to follow sort of the national guidelines in terms of staffing, and it has to be reasonable and justified. So there isn't a magic number. What I would recommend to look at is, I think there might be some protocols in terms of staffing for WHO and guidelines for the local Ministry of Health that says that like a primary health care facility should have XYZ staff, and you want to make sure that you meet that quota and not go above it. So I think that's how I would look at it.
Wonderful. And the next question here is from Megan. Is there a specific amount that can be requested in the budget, or is it at our discretion?
Is there a specific? I'm trying to scroll there as well. I'm trying to understand that question. Is there a specific amount that
can be requested in the budget, or is it at the organization's discretion?
So if there's a call, it will mention the ceiling. If there's no call, it's at your discretion, but you would have to do your homework to figure out what a reasonable amount is. Again, you have to make sure you are able to justify what you're asking for in terms of providing value for money. And there isn't any guidance on that. It's pretty much a strategic decision that you have to figure out. If you're going to do a program that's $2 million and reach 20 people, I don't know if that would seem like a very fundable opportunity. So just be aware of that. That you have to be conscious of offering value for money and how much you can ask for and what's reasonable as well.
Excellent. And so there are 3 questions on the screen, and I'll read them out. But maybe just a note while I read out the first 2 questions, the person from International HIV/AIDS Alliance, I see that it's remuneration costs for consortium. Can you please expand on your question while I read the others? Thank you. So the next question is from Julie. Do you see any caution in using the unsolicited process? There seems to be concern it takes too long for review at Global Affairs or proposals don't move forward.
I don't necessarily, it's variable. We've seen unsolicited proposals that, get funded in 3 months and some sit there for 2 years. I don't really know. But if you go into a solicited process where there is a competition, the competition is quite intense. And some organizations cannot apply for a solicited because they might not have the ability to raise match. So there's different strategic decisions that people take. Sometimes between calls, it can be 3 years and there's no call on, like the last call for health was over 2 years ago, and there's been no funding since specifically. So people like to keep the unsolicited proposal open in case there might be some opportunities where there might be some funding available. Also, part of submitting the proposal is there's a technical part of actually doing the proposal, but you do need to have some meetings with global affairs and counterparts and do your homework to see whether it's something that's within their priorities and something they might want to fund. You don't just submit an unsolicited proposal just because you can write one. You have to make sure that there is a need and it meets the global affairs priority and the priority in the country, and there might be an appetite for them to actually fund it. So there is some homework, and I can't advise you on that. It's a very personal thing, and a lot of it has to do with lobbying and different relationships. But that you do need to kind of do a little bit of networking and figure out strategically whether you want to put together a proposal or not in an unsolicited format.
Wonderful. And the next question is, could we bother you to share your experience with the review process for unsolicited proposals conducted by Global Affairs?
I don't really know how it happens. I don't work at Global Affairs, so I can't really comment on that one. I'm assuming that it gets pulled out of the portal and then it gets circulated amongst different desks and the country where it's supposed to go. But I'm not sure about the process at all. It's not clear.
Wonderful. And the last question before we close here. Remuneration costs for consortium partners, are these included in the organization section, or do you need to separate costs by each partner? Yep, so that's the question.
It depends on how you set out your budget. If you look at the budget categories, I've done consortium projects with several partners, and we would have the remuneration cost by each partner, and then tally them up together. But I would basically how you get to because what Global Affairs is asking for is a very generic budget by cost category. So as long as you're clear about that, then you would do that. But in terms of how you make those decisions, I wouldn't really do that. Yeah. So hopefully that's useful.
Well, actually, wonderful. Thank you very much, Tariq. Would you like to say any closing remarks, or can I go ahead?
Sure. I'd just like to say that I think it's a big investment, and it's a lot of time and resources. But if you do it realistically, in partnership and collaboration, follow the guidance, I think you can be really successful at writing a proposal. So don't give up. And I really do believe small organizations have a lot of potential. So I encourage you to use the tips and to submit proposals and make a difference in the world. So thank you.
Thank you very much, Tarek, for your very practical comments and your insights. To our participants, thank you for joining us today, and a special thanks to Andy Craig and the team at CanWatch for facilitating this collaboration. And a special thanks as well to the team behind the scenes, Karine Wong at the British Columbia Council for International Cooperation for providing technical support, and Jackie Wasikis, the Executive Director of the Saskatchewan Council for International Cooperation, who chairs the Inter-Council Network's webinar committee. Before we sign off, a quick reminder that a survey for this webinar will be sent to all participants at the email address you provided upon registration. Your participation in the survey is much appreciated, and please recall that only those that complete the survey will be receiving a message with the video recording of the webinar, as well as the PDF slides of Tarek's presentation. If you're interested in joining us for future ICN webinars, the best way to stay connected is to join the ICN webinar email list. A link to this list will also be sent out in the survey invitation. So thanks again for joining us today, and stay tuned for our next webinar. And thanks again, Tarek. Have a great rest of the day.
Thank you.